good afternoon. My name is Ricchiuti, and I'm going to be presenting my Master's of Science in Nursing Capstone project titled Compassion Fatigue: Identify, Prevent, and Overcome. I have my Bachelor's of Science degree in nursing, which I obtained in 2011 from Russell Sage College in Troy, New York. I was employed as a pediatric registered nurse at our local hospital and then specialized in pediatric oncology after that for a full 7 to 8 year career in the world of pediatrics. I am now a certified case manager working for a health insurance company. And I selected my project on compassion fatigue because it's something that's been important to me as a former pediatric oncology nurse, because I feel it's something that I experienced and witnessed a lot of my colleagues experiencing it as well. There's a lot of evidence out there about the prevalence of compassion fatigue in all helping professions, but especially for RNs. So compassion fatigue is defined as a phenomenon that occurs when the workforce is placed under extraordinary stress due to exposure to trauma. The afflicted can experience emotional stress and prolonged duress after an event. So compassion fatigue, in other words, is described as secondary traumatic stress disorder, and it occurs when people have a front row seat to the suffering of others. And this impacts your own health, it impacts your relationships, and it impacts your ability to perform your job. So the stakeholders in my presentation and project are the pediatric registered nurses themselves, the pediatric patients at the hospital administrators, and the entire interdisciplinary care team. So evidence suggests that compassion fatigue negatively impacts the nurses themselves in their physical health. It can be seen in increased risk factors of developing coronary artery disease, high blood pressure, obesity, sleep disturbances, and even depression and anxiety. Pediatric patients can notice a difference in the care that they receive when their nurses are experiencing that secondary traumatic stress disorder. There are increases in negative patient outcomes, including medication administration errors. And as far as hospital administrators are concerned, compassion fatigue is a leading cause of turnover among nurses. Turnover for one nurse can cost an institution between $37,000 and $700, anywhere up to $58,000 and $400. So it's estimated that hospitals spend between $5.2 million and $8.1 million per year on turnover. And so if a core reason of turnover, such as compassion fatigue, can be addressed, this can save institutions a lot of money. The interdisciplinary care team is negatively impacted by compassion fatigue in regards to communication and the patient outcomes as well. So evidence that I used for this project are different from mostly this section will talk about nursing journals, the effectiveness of the staff resilience program in pediatric intensive care unit, backed the design of my project. Burnout, compassion fatigue, and secondary trauma in nurses, recognizing the occupational phenomenon and personal consequences of caregiving. Running on empty, compassion fatigue in nurses and non-professional caregivers. Compassion fatigue among registered nurses, connecting theory and research. Nurse-patient connectedness and nurses' professional quality of life, experiences volunteering at a pediatric oncology camp, and then the professional quality of life scale. Other evidence used to support my project that are from non-nursing relations or professions are Teaching and Nursing, a Guide for Faculty, which is focused on education, the graduate level QSEN competencies, the constructivist teaching learning theory and participatory teaching methods, the National Healthcare Retention and RN Staffing Report, and preparing nurse leaders in nursing professional development. So the theories that I focused on for my project are the constructivist learning theory, which takes a participatory approach where students actively participate in the learning process. So instead of the teacher delivering the information to the students and guiding how they learn, the teacher just provides the information for the students to absorb ahead of time, and then when everybody gets together, you're allowed to critically think about the information, and the teacher becomes a facilitator. So I delivered the information on compassion fatigue to the RNs in the form of a bulletin board in their staffing area, and then through some different models via YouTube, since I was unable to get into the hospital and see them. So I provided all of the information, and then debriefing sessions occurred after the fact where nurses could bring together their experience. So the nurse who worked for 10 years on the floor versus the nurse who's worked for 1 year on the floor could talk and critically think and learn from each other with me as the facilitator. The other learning theory that I found applicable to this project was the humanistic learning theory. Humanists see the purpose of education as fostering growth, self-development, and creativity, and it enhances the human experience. So because compassion fatigue is such a psychosocial topic and method, this felt like an appropriate learning theory, since we wouldn't just be discussing facts and statistics, but we would also be discussing things like the human experience, and then looking for growth and self-development among the nurses. So the learning outcomes that were created for this project are the students will be able to summarize current trends in compassion fatigue, identify symptoms of compassion fatigue among healthcare professionals, list the risk factors for compassion fatigue among healthcare professionals, classify responses to workplace stress as a help or hindrance to managing compassion fatigue, and the students will be able to generate a list of available resources for self-care and management of secondary trauma. So with my project design, I reached out to my formal supervisor and clinical nurse specialist on the pediatric oncology unit at our local hospital, and discussed my ideas about compassion fatigue, and wanted to see if she felt it was something that would positively impact her RNs. And it was determined that it would. She really felt that the compassion fatigue was something experienced by the nurses. And one of the main things that she brought forward was her concern over the nurses just kind of burying their feelings, and would just go from one patient to the next if there was a large loss or a difficult experience. The nurses were not accessing resources available to them from a bereavement standpoint, and they are experiencing turnover where nurses don't stay on the floor too long after they are oriented. They find other employment throughout the hospital. So it definitely seemed like it was an appropriate topic and an appropriate place to execute it. So I started off by administering the Professional Quality of Life Survey, which is an evidence-based tool that was developed. It's been around for about 15 years. It had initially come about after testing over 3,000 RNs to just develop this tool and definition of compassion fatigue, burnout, and stress. So we administered this to the nurses, and we were able to prove incidents of compassion fatigue on the floor, which we'll go over that. After that, I delivered learning material to the RNs about compassion fatigue, how to prevent it, how to identify it, effective coping mechanisms, ineffective coping mechanisms, and just getting all that information over to them. Then we had some debriefing sessions with reflections between the RNs on the floor, myself, and my mentor. And then we administered a survey for feedback on the project design and efficacy, and just to figure out if the nurses were able to absorb the information that was delivered to them. So here you'll see the Professional Quality of Life tool. It has 30 measures. Some examples are: I am happy, I feel connected to others, I jump or am startled by unexpected sounds, I feel like my work, or I like my work as a helper, I'm the person I always wanted to be. My work made me feel satisfied. So there's 30 different statements like that, and then the nurses have to score them on a scale from 1 to 5, saying they feel that never or very often, and then throughout. So we were able to find that out of 50 nurses surveyed, 31 of them felt that they had a moderate burnout and 7 had high levels of burnout. And then from the secondary traumatic stress scale, 28 reported a moderate amount and 6 reported a high amount. So obviously we would hope that these numbers would be heavier in the low category for burnout and secondary traumatic stress, and more nurses in the high level of the compassion satisfaction. So this just was a good way to prove that compassion fatigue is a problem in this area, and hopefully we could do something about it. So the project was delivered through my initial introduction in person with the nurses when I administered the survey. That happened over a few weeks initially to meet all the nurses and give them that survey, and then I created the bulletin board on the floor. After that, we had to change gears due to the COVID pandemic and my inability to actually get into the hospital and see the nurses face to face. So we delivered a lot of material via YouTube, and there's a whole playlist of all of the material created, and then also utilizing Pinterest. So not only did I have a Pinterest board in compassion fatigue, but it was a project that I suggested the nurses participate in themselves. I was also able to meet with some nurses and my mentor via Zoom throughout the project just for check-ins. So in evaluation of the project and achieving the outcomes, RNs were able to define compassion fatigue, list the risk factors, identify traits associated with compassion fatigue, and report new self-care methods. They were also able to identify good things they could be doing and bad things that would not necessarily help. So as far as the effect on the organization, it's hard to tell at this time. In the short term, my mentor did report back to me that after a recent death on the floor, she felt that the nurses utilized the bereavement resources more so than they had in the past, and some had reported it was due to a greater knowledge and just effort in preventing that compassion fatigue and taking better care of themselves. Unfortunately, throughout the nursing field right now, stress and secondary trauma are really prevalent due to the new issues brought forward by the COVID-19 pandemic. So I did not feel it appropriate to re-administer the professional quality of life tool because the nurses have so many outside factors aside from their day-to-day things that we were initially testing. So from a long-term standpoint, we would be able to go back and see how the nurses are doing in 1 month, 3 months, 6 months, and 12 months in regards to turnover and just their accessing those resources and understanding of compassion fatigue. But in the short term, it definitely did have a positive impact on the care team after the loss of a patient that they took care of for 3 years. So just looking at this project and the significance to nursing and how it supports excellence, it's important to support the caregivers because they will be better care providers to their patients if they're supported themselves. And one of the most important things that we can do is to take care of the nurses. So this project will help support RNs in their own personal and professional lives in order to better themselves as RNs and care providers. From a global standpoint, we are experiencing a very rare time in medicine with this pandemic, and nurses across the world are experiencing trauma like they've never felt before. We all expect to face some trauma and death, but there are reports out there that one nursing unit is losing 15 patients in 1 day. So our nurses are gonna be hurting for a long time after when we get out on the other side of coronavirus. So compassion fatigue definitely has global implications, and it would be possible to administer material like this to support nurses in the future. The fact that everything's available online through YouTube and Pinterest is actually a unique positive of how the project changed, because it would be possible to administer it on a broader scale. So as a member of the interprofessional team, I had the opportunity to work with the clinical nurse specialist, with RNs, with the nurses' aides. Some of the secretarial staff participated in the project, and it was really a unique experience to act as a leader among those professionals and deliver this material. And I think my favorite part was getting back together and talking it over and seeing the impact that it had on the nurses and hearing their feedback. And then the other neat thing was, because of the location of the bulletin board in the nursing conference room, the pediatric residents meet there in order to do their sign out at the start and end of each shift, and they had some feedback about the bulletin board and compassion fatigue resources that were out there. So I was able to share a lot of the education with the pediatric residents too. So that was really kind of an extra layer of satisfaction. So from a, what this project taught me standpoint, and how I was able to meet some of the learning outcomes set forth for me, new knowledge. I always knew that compassion fatigue was a problem. I didn't necessarily realize the scope. The cost of nurse turnover was astounding to me. So that was definitely really interesting, and just the importance of knowing who your stakeholders are and having kind of a foot to stand on when you bring forward a project. New skills for me, definitely technology. Technology is not something that I've really ever excelled at, so to have to make such a drastic shift in my project plans and incorporate so much technology was definitely new for me, and I think that it will definitely help as I move forward. So the American Association of College of Nursing talks about scholarship as having attributes of a professional specialty, and then the significance to the profession, getting creative, and being able to document and replicate your results. So I think that this project really talks about scholarship and really supports the idea of scholarship when it becomes to the significance of the profession. So pediatric oncology nurses are one of, that compassion fatigue is really prevalent there because of the trauma that they experience. Nobody likes to see sick children. And so it's definitely something that's documented throughout many institutions, and we were able to replicate it at our institution locally. From a spirit of inquiry standpoint, my mentor was really a wonderful source of information for me, and getting to explore all that new evidence and just have our weekly conversations and pick her brain with her experience in nursing. And then also learning of the theories and the different learning competencies out there from the professor in the class that I was taking. Spirit of inquiry really played a large role in bringing my project to a deeper level. From an innovation standpoint, innovation, we learned is all about taking risks and utilizing technology, creativity, coming up with new ideas. So a lot of, not many people focus on the psychosocial aspect of things, especially when it comes to nursing. We're task-oriented, we're skill-oriented, and it was really interesting and felt innovative to be able to bring forth a psychosocial project and idea, and then find different ways to deliver it to the RNs. I couldn't take up 6 hours of their time with a lecture, because that would just cause more stress, which we're trying to reduce. So the innovative ways to provide little tidbits of information over time and really meet them where they were at was really, really interesting. And from a lifelong learning standpoint, RNs, we are lifelong learners, and this was a really, interesting project to do and to obtain my master's degree in education. The field of education is always changing, and that is no more evident than it is right now. I teach for clinical students learning in the OB setting at the hospital, and in the last 3 weeks we've had to completely change everything to the virtual world, and it was really fantastic to have the background of my master's and be able to utilize technologies and keep it interesting for my students, and I've been having fun doing that and look forward to doing that in the future. So in conclusion, I selected this quote and image because I think it really speaks a lot to compassion fatigue and the importance of it. Nurses like to put on their coat of armor, and it's not good because that coat of armor doesn't last forever. So the quote reads, "The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet." So I will leave you with that in compassion fatigue and my project on identifying, preventing, and overcoming it. Thank you.